about helping manage risk under employee benefit programs. And so I think we've got some things that will be of interest to you today. The second thing is kind of from a personal perspective. My dad was born in Woodbine, Kansas.
Man.
And as a kid, we would come up to Abilene, we'd go over to Harrington, where one of his sisters lived for many years. And as we came through Abilene, he would point out the courthouse and he would say, "You didn't know that Langhoffers were famous, did you?" And the name Joe Langhofer is up on the side of the courthouse. And I believe that so there was a Joe Senior and a Joe Junior. I think that Joe Senior's name is the one that's up on the courthouse. I believe that he was my dad's uncle, maybe a cousin, but just so you know, I was told from a little kid I was famous.
Welcome back.
Yeah, exactly. Thank you for allowing me to come in today. I hope what we talk with you about is a little bit different than what you've heard from other brokers in the marketplace. I thought what I would do is, instead of going through the complete presentation, you can look at that presentation at your convenience. But I thought I would talk a little bit about who USI is and tell you why we think we're different than the majority of brokers in the marketplace. USI is an organization. We are a large brokerage firm. We have 10,000 employees and 200 offices around the country. But the reality is business is done face to face. And I'm from Wichita, and the very first customer that I had up in this area is right up the road, and that's Abilene Machine. I started working with Abilene Machine in 1994. I also worked with Salina Vortex over in Salina since 1994. But we do a lot, not only in the private sector, but also in the public sector. So from a public sector perspective, the counties that USI works with, and I'm going to name just a few. We work with Reno County over in Hutchinson. We work with Landa County. We work with Kingman County. We work with Potawatomi County east of here. But we also work with a lot of public entities. And so I'm going to give you several public entities that I work with specifically that I think would be meaningful for you to talk with at some point as you not only evaluate what broker ultimately, if you decide to make a change in broker, what broker you work with, but also what they've done from a strategy standpoint to help them manage their costs. That makes sense? By the way, I also work with Salina Regional Medical Center. I work with City of Manhattan. I work with City of Manhattan 20 years probably, Raleigh County Police Department, so on and so forth. A few specific public entities that I work with. I've worked with the Kansas Turnpike for over 20 years. I work with the City of McPherson. The City of McPherson I started working with in 2015. January 1 of 2025, they made the decision to move away from Blue Cross after being with Blue Cross for 50 years. And I'm not advocating for that. It doesn't matter to us who ultimately you choose to partner with you on a go-forward basis. We have fully insured customers that are with Blue Cross, Topeka School District, with roughly 2,200 employees on their plan. They're fully insured with Blue Cross. So it doesn't make any difference to us. But having a partner who can help you make decisions about your programs and design your plan that will help you manage the costs for the county is super important. City of McPherson on that move, January 1 of 2025. I met with them last week after being, in fact, they have never been away from Blue Cross until January 1 of 2025. And they made the decision to move. And last week they said, we're happy that we made the move. And it's not so much that they're happy to move away from Blue Cross, but they feel like they have a path to move forward to help manage their cost and also help manage the cost for their staff. There, from a health insurance perspective or a healthcare cost perspective, there are some things, and it doesn't matter who ultimately you choose as your health insurance vendor, there are some things that you will never get away from. You will not get away from increases in cost at the doctor and the hospital side. You're not going to get away from an individual's genetic predisposition to developing a medical condition. It doesn't matter how much wellness you throw at it. It doesn't matter. You just can't impact those things. But there are some things that you can impact. And we're going to talk about some of those things today. And it's not so much in terms of choosing a broker to help you go to market. That's important. But we believe you choose a broker to help you manage the things that are manageable and help guide your plan to the point where you're not facing substantial increases. And there are things that we can specifically do to help with that. So in your packet, if you open it up, on the right side of your packet, you're going to see a PowerPoint presentation that's 41 pages long. We're not going to go through all that, okay? What I want to focus in on is what's on the left-hand side. And on the left-hand side, you're going to see a one-page document that's called the USI Omni. And Ron, that's over on the left-hand side right here.
Yep.
Okay. This is, in my opinion, really gets at what gets at the heart and soul of who USI is as an organization and how we work with our clients. One other thing that I should mention to you is I joined USI in 2017. I started my insurance career as an underwriter at Blue Cross, and it was specifically a government accounts underwriter. So the only entities that I did underwriting on the medical side for were governmental entities. And as a governmental entity, you have several factors about the way you do business that are different than what we see in the private sector. The first thing is you mentioned, Kenny, at the beginning of this about open records. The fact of the matter is, doing business in an open record environment, you have tremendous accountability to the taxpayer, to your employees, to the public in general. Second thing that makes it a little bit unique as a governmental entity is that you don't necessarily have the ability to go out and pull in additional credit, additional funds that public, that private entities that have the ability to do. And so managing to a budget and making sure that your expenses are in line from a budgetary perspective becomes super important. And we understand that. The second thing that's impacted about me joining USI in 2017 is throughout my insurance career, even when I first started working with Abilene Machine in 1994, the way USI does business is the way I learned to underwrite by looking at individual risk management strategies to help control costs. And so I owned a consulting firm. I brought that into USI in 2017. So what this Omni actually represents, the Omni essentially means one. We have, and this is a system that is used with all of the USI consultants across the country in all 200 of our offices. There are specific things that we do from a risk management standpoint that helps our clients maintain financial stability in their plans. Anytime we make a change in a benefit plan, there are two things that we absolutely have to ask ourselves. The first thing is, how much is that going to impact the plan financially? The second thing we ask is, what is the impact going to be to the plan participants or to the employees of Dickinson County? Because if the impact to the employee is so great, the financial sometimes becomes less important. And you always absolutely have to balance those things. So what you're going to see, and I did not have specific numbers to go on, but I used about 150 employees or so. And I used an annual cost of about $14,000 per employee, which means the estimated annual cost of your plan is about $2 million. I don't know if it's north of that or not. Is that about, probably a little bit north of that, isn't it?
Yeah, because we only have about 104, 105 on the plan.
And anticipated premium with Blue Cross is about what?
Uh,
I didn't bring my sheet with
Yeah.
me, did you?
no.
And that's my mistake. I think it was 106. I told him 160.
Oh,
I heard that wrong, so I apologize.
That's no problem.
So like, so most people are on the employee only plan, which runs us, let's guess here. So an employee only plan runs about 21,000, 622,000 a year just for the employee plan.
Just for the employee only. Wow. So you're probably up over 2 million a year.
That might be right.
Health insurance spend. Is that right? Okay. So what we would do is we would go back and adjust these numbers so that you could see the actual impact. And this Omni report is something that we do with every single one of our clients every single year. And believe it or not, we start this process 2 months after your renewal. So if you renew on 8/1, hypothetically, sometime in October, we're coming back out and we're saying, we're starting discussions for the following year. So when you look at this and you break out your medical plan specifically, there are claims at doctor's offices. There are claims inpatient in the hospital. There are claims from an outpatient perspective, and there are pharmacy claims. And what you see as percentages down the kind of the middle of the page, that's ordinarily what we see. Now, in the information that Marcia sent me, when I looked at your claim experience from 2024, your prescription drug claims were about as high as what your medical claims were.
Mhm.
And we're going to continue to see that trend moving forward. And that becomes exceptionally important. And it's important because there are ways to manage the prescription drug costs differently when you have a partially self-funded plan. And the impact can be really significant. And I'm going to give you one example. In 2022, the medication in the US that was the most widely dispensed specialty medication is a drug called Humira. Made by AbbVie, the market share in 2022 for AbbVie for Humira was $22 billion. That's with a B. In 2023, AbbVie lost its patent on Humira. When that happened, we initially saw a couple of manufacturers produce Humira. And now we have over six, the biosimilar for Humira, and now we have over 16 of them. The thing that is important about this is that Blue Cross, United Healthcare, and Cigna all left Humira on their preferred medication list. Aetna, however, didn't leave it on the list. They went out and bought a manufacturer that produces a biosimilar for Humira. Humira on average was at the time was running around $7,500 to $8,000 per month. The reason why the insurance carriers left Humira on their preferred drug list is because they get rebates from the manufacturer. And when I say rebates, think about going and getting a set of tires. You get a coupon that you can send in and get money back. The rebates in 2025 for Humira are 70% of the manufacturer's cost. So, and this is an indictment, this is not an indictment against Blue Cross. Unfortunately, this is the way our healthcare system operates. The cost of Humira coming to the plan, let's say, is $100,000. And the insurance company, on the other hand, gets $70,000 back in rebate. When you are fully insured, the insurance company is not reducing your premium based on the rebates that they received. They pass the claim cost on to the plan, but they don't give the rebates back to the employer. When you are partially self-funded, that doesn't happen. We get the rebates back. And furthermore, you've all heard of Mark Cuban, right? Mark Cuban, through his cost plus drug company, the Humira biosimilar is $700 a month, not $7,500. So we take a drug that essentially is at $8,000 a month, $7,500 a month, drop it to $700. We don't care what the rebates are then. And now we have an individual taking a medication that is bio-identical to what Humira was. And we don't have the insurance company increasing our cost because our prescription drug cost is now much lower. Does that make sense? So when you start to look at these strategies, the reason why it becomes important not just to go out and look at different insurance companies, but to have a trusted partner who will go through your plans and manage each element of risk under your plan becomes key to helping maintain your cost structure in the future. So if you look at the back side of this, you're going to see a number of different strategies. And what you see on these strategies is you're going to see the dollar savings on average that we would project. You're also going to see the percentage, and you're going to see what the disruption is for individuals that are covered under your plans. So the very first one that you see is an alternative funding analysis. And what an alternative funding analysis is we're going to do an analysis to determine, is it better for you to be fully insured, or is it better for you to be self-funded? And part of that analysis is not only looking at what the costs are going to be, but also projecting what the cash flow looks like for the county. A good example of this, and this would be another public entity that you could talk to, USD 465 in Winfield, Kansas. They had never left Blue Cross until about 4 years ago. They made the decision to leave Blue Cross. We did the analysis for them, and the savings for them has been phenomenal. And they are now in a position where they have tremendous surplus. And this was one of the main strategies we looked at, and it was a concern to them because as a school district, very much like a county, there's only so much money. And what happens if their self-funded plan ends up running in a deficit position? Then what do you do? They didn't have a lot of choices, but we worked with them, showed them what the path looked like. And so it's not just about shopping for insurance, it's also about coming around your finance team side of the table, city manager's office, HR department, and saying, all right, let's walk through this and let's actually see what it would look like for you. I want to show you, and this is the only slide that I'm going to refer to in this slide deck. I want you to turn to page number 14. And on page number 14, you're going to see 3 different graphs or 3 different trend lines. The turquoise trend line is after a 1-year period, what the probability based on employer size is of a self-funded plan costing less than being fully insured. Across the bottom of the table, you're going to see numbers, 100, 250, 500. And this is based on a Windsor Strategy Solutions risk management tool. They use a Monte Carlo approach. They throw over 1,000 different models at it. What this tells us is this: if you make the move from being fully insured to self-funded, after 1 year, you have about a 72% probability of it costing you less money. When you move to 3 years, and that's the black trend line that you see, it goes up to about an 85% probability. And if you move up to 5 years, there is a 90% chance that being self-funded will cost you less money than if you're fully insured. And that becomes important. If I would say to you, I'm going to give you $100, I want you to go to Vegas and I want you to gamble it. If you had the opportunity to know that you have a 70% chance or better of winning on that gamble, would that be the first place you bet the money? I think probably so. And where the majority of that savings comes from, and this goes back to the Omni, where the majority of that savings comes from, it comes from the prescription drug side. There are less risk and reserve fees, and I won't get into that for the sake of time, but there's less fees being having a self-funded plan than there are if you're fully insured. So from an underwriting and analytics standpoint, just so you're aware, we've got over 180 underwriters on staff. These are individuals that do the financial modeling day in and day out. It also helps that I'm a former underwriter, and you would be working with me should you make the decision that USI would be a good partner. On the HR services side, you might not think that your HR team impacts risk for the county, but I want you to think about it from this perspective. When you first engage with a prospective employee and you show them what their salary and benefit package is, and you show them the resources that you provide for them and their family around health insurance, that is a risk that you're taking by presenting to them what you have. And they make a determination, do I want to work at the county or do I want to go somewhere else? And so when we sit down with your HR team, those are things that we think about. How are we communicating the benefit packages? What tools are we giving your HR team, and what tools are we giving your employees to effectively manage what they have going on with their lives? Those are all things that we consider in every single engagement we have with our clients. There's also a lot of compliance that your HR team has to deal with. Even this big, beautiful bill. And whether you believe it's a big, beautiful bill or not is not the point. But the big, beautiful bill has some employee benefit provisions that are baked into it. Dependent care spending account allowance is going up. I don't know whether you've heard of a direct primary care model or a concierge doctor, where you pay a subscription service each month and you can go to the doctor 50 times in a month if you can get in. That's impacted under federal law. So from a compliance perspective, we've got 30 attorneys on staff. They're not to help us, they're to help our clients deal with these compliance issues as they come up. Let's talk about population management real quick. Over the course of the last 20 or 25 years, in fact, I'll use Salina Vortex as an example. They were my first client in 1996 that implemented a tobacco use surcharge in 1996.
Mhm.
We have seen a lot of organizations implement biometric screens, where you take a blood test. and you do a cholesterol test and a glucose test. Those things are great on the surface, but the fact of the matter is, once the test is done, most people forget about the results of that test. What becomes more important is to ask individuals to engage with a primary care physician on an annual basis and let that primary care physician get engaged with managing that individual's healthcare. As we age, our metabolism slows down, higher chance of high cholesterol, higher chance of diabetes. We don't lose weight as quickly. It becomes a battle. And every single one of us have to deal with that as a result of being human. We're not getting away from it. And so developing plans to help manage that component of it. And the corollary to that is early diagnosis. We are seeing higher cost of cancer treatment than what we have in the 30 years that I've been in this business. There's a new cancer treatment that's called CAR T therapy. And it is chemotherapy where they take individual T cells and they energize those T cells and they become like zombie seeking cells. It's $90,000 a month. And so getting early diagnosis, we know that the 5 most common cancers, colon cancer, lung cancer, breast cancer, ovarian cancer, and prostate cancer, with early diagnosis, not only does the survivability go up significantly, but the cost goes down in treatment. Those are things that we're going to talk about because that's part of managing risk. Does that make sense to everybody? Okay. I'm going to leave it at that for now, and I'm going to give you the opportunity to ask questions.
You kind of touched on it already. I was going to ask you the biggest cost savings, but you kind of really beat me to that. As we said, we're only 106 employees, so I want to reinstate that.
Sure.
You said, you said there was a couple organizations that went self-funded. Who were those organizations again?
So this one that I would encourage you to reach out to is the city of McPherson, Kansas.
Okay.
And I can give you, and I can send those back to Marcia or whatnot, but I can give you the contact individuals there. I know they're more than happy to have a conversation with you. They were self-funded when I started working with them in 2015. And just as a side note, when they, in 2015, beginning of 2015, they had $1 million in surplus. By the time August rolled around, they were down to 150,000. And they were using a broker out of Kansas City. They called us, we got involved, and one of the things that is super important is to have good, accurate claim projections. And in that particular instance, the broker in Kansas City was using the Blue Cross Blue Shield claim projections. And Blue Cross, when you're self-funded, they use a 30-month average to project your claims if you're self-funded. Well, they give the most credit to last year. And so with the city of McPherson, they had a really, really good last year. And as a result of that, Blue Cross's claim projections were too low and they underfunded their plan. We look at the insurance company's claim projections. But our underwriting team, we're going to give you our own claim projections because we're there to help stabilize costs and help manage costs. We're not there to generate profit or fall within the risk models of the insurance carriers. That's exceptionally important. So Kenny, they were self-funded. We jumped in, we got their plan stabilized. And the reason why I think I would talk to them is because their team is pretty knowledgeable and they moved away from Blue Cross on January 1 of 2025. They're super good people. I'd also encourage you to talk to Raleigh County Police Department if you're interested. They are self-funded. I moved them to Blue Cross on a self-funded basis in 2013. And I started working with them in 2012. And they have a lot of experience managing their self-funded plan at Blue Cross. Those are two. I can give you numerous more. if you would like. Reno County would be a good one to talk to from a county perspective.
I think it'd be nice to have a case study, and see how they fared with it.
Yeah. USB 465 would be a good one because they were fully insured, similar to you all. And they made the move to a partially self-funded plan.
Okay.
So would you like for me to get those contact
If you
names?
could, and get it to Marcia and Jeanette,
I
that'd be
will do
great.
That would be great.
Out of courtesy, I'm gonna make a call to them first,
Mhm.
give them a heads up.
Sure.
that, someone will be calling.
I have one more question. I'll leave it to the staff. Have you seen any significant service drop with moving to Aetna, or is that a very comparable to Blue Cross? I guess that would probably be a concern of some folks.
It's gonna be a big concern of some folks.
Okay, yeah, good question. So I hate to answer a question with a question, but it depends upon what part of Aetna you're talking about.
Okay.
So you've got Aetna as a mothership. Aetna also has a third-party administrator by the name of Meritain. Okay? Meritain uses the Aetna network, and they happen to be owned by Aetna. And so I will tell you from a flexibility standpoint, Meritain as a third-party administrator is much more flexible than Aetna mothership is. That makes sense? It also will depend upon how your plan is designed and organized. There are some things that Blue Cross does that not every insurance carrier or third-party administrator does standardly. And so the plan has to be designed correctly. The other thing to note is that Blue Cross pays about 90% of their claims electronically. So they have what we call a 90% auto adjudication rate. Comes in from the doctor, 90% of those claims never touch a person's hand at all. And the way they're able to do that, there's a couple of ways. The first way is that they don't allow for much variation in the plans. You don't have a lot of flexibility. If you wanted to pay for a gallbladder procedure in a certain way, and that might be a little bit differently than what you might pay for an appendectomy, and I'm just giving you as an example, Blue Cross didn't want to let you do that because they want those claims to be auto adjudicated. When we move to a partially self-funded plan, there are things in general that I'm going to recommend to you that are different than the way Blue Cross handles it. A good example, with Blue Cross, oral chemotherapy is paid for at 100%. No deductible, no co-insurance, no co-payment at all. Question is, with the cost of chemotherapy going up like it is, and if the manufacturers are willing to help us out by giving us some financial incentives, why would we pay oral chemo differently than what we pay for someone that goes in and has an open heart procedure? Does that make sense? And so sometimes those things, we need a little bit more flexibility. And that's a long way of answering your question. Anytime you make a change, I don't care who it is, anytime you make a change away from Blue Cross, you will have disruption. One thing that, and I'm going to use one of the customers that I mentioned, one of the things that was really important is that all of the decision makers that sat around the table in their benefit committee, they all knew why we were doing what we were doing. Every single one of them. And they were all on board. And so when the disruption occurs, I can't get my Humira. I was able to get Humira before. Well, that's because we have a drug now that's $700 as opposed to $7,500. And it's the exact same medication in terms of how it affects your body. Having everyone aligned from that perspective, it really helps. And now, in the meeting last week, a lot of the employees have come back and have said, my prescriptions are a whole lot less now than they were before. That's exactly right. And so understanding where we are and why we're doing what we're doing across all of the decision makers, and communicating with staff becomes important. And I don't care whether it's Aetna, whether we move to United Healthcare, whether we move from Blue Cross fully insured to Blue Cross self-funded. There are things that are important to communicate.
Thank you.
See that?
Any questions, Marcia? Janelle?
How are you saving money with prescription drugs? Are you not covering some now? Because not all of them have generic.
That's correct. That's a great question. There are a variety of things that we do. So the first thing is, let's look at, and I'm going to use the Humira and the Yosemite as an example. So Yosemite is it's called a biosimilar medication. So, and I'm going to give you a couple of other examples as well. On TV recently, have you seen ads for Skyrizi?
Mm-hmm.
Have you seen ads for Rinvoq?
Mm-hmm.
Okay. Humira, Skyrizi, and Rinvoq are all made by AbbVie. And guess what? They all treat essentially the same conditions: rheumatoid arthritis, Crohn's disease, psoriatic arthritis, and ankylosing spondylosis. And it's a super important drug. I have a nephew that has 3 of those conditions. His maternal grandmother at 70 years old was hunched over like this because of those conditions. So to answer your question specifically, if we can get a biosimilar to Humira at $700 a month, as opposed to paying $7,000 a month for Humira, and the FDA says that the effective ingredient in those drugs are identical, why would we pay for a $7,000 drug when a $700 drug does the job?
Yeah.
Does that make sense?
Yeah, but it still doesn't really answer the question. Are you not covering drugs that because there's no generic?
No. You don't do that. We don't have any clients that are saying, we're going to exclude these drugs.
Or because that's not what they were meant for? Because there is drugs that have alternate uses, but they're not meant for that.
Exactly. So I'll give you an example of that. And really, when an employer is self-funded, they get the opportunity to make those decisions. So I'll give you an example. Let's talk about the GLP-1s, Ozempic, Mounjaro, Tresiba. So those drugs are GLP-1s, and originally the FDA did not intend for those to be used for weight loss.
Mm-hmm.
They were for type 2 diabetics.
Yep.
Latter part of 2023, we started to see a huge increase in doctors prescribing those drugs off-label.
Mm-hmm.
It also caught Blue Cross off guard, and they did not have any sort of prior authorization process in place to get the medical records to determine, is the doctor prescribing it for type 2 diabetes, or are they prescribing it for weight loss? And so with most of our clients, when we see those sort of things occurring, we will ask them, you want it covered for weight loss? And if you do, let's look at what the cost is for the plan.
Mm-hmm.
If you decide that you don't, but you have employees that are asking for those medications, are there other ways that we can help the employee? Most of our clients have made the decision to not cover GLP-1s for weight loss, majority. The follow-up to that is, though, 2 of the manufacturers have programs where the cash price of those medications, if the employee buys it, is much less than what the prescribed version is coming through the insurance plan. And so if you look at Lilly, and you can go out and look at Lilly, Lilly has a GLP-1 called Zepbound.
Mm-hmm.
And you can get Zepbound, 5 milligrams Zepbound, I think it's 5, maybe 2.5, for $325 a month. If we're covering the GLP-1 under the plan, that's going to come through at $1,000 a month cost. And so
Even when you're commercially insured, they let you pay that?
they will. They absolutely will. Yeah. And so it becomes important when we talk about managing risk. There are a lot of different ways that we can manage it.
Is that directly bought through the manufacturer though, or through? the
Directly bought
pharmacy?
through the manufacturer.
Okay.
Directly bought through the manufacturer. Yep. And so to specifically answer your question, if there is a drug out there that does not have a generic or it does not have a biosimilar, and for the sake of time, I won't go into the difference between the two. But if there's a drug out there that's a name brand drug or a specialty medication that does not have a generic, the way you manage that cost, there are several different strategies, but one of which, and I'll give you an example. You've seen on TV where it says pay as little as $5 a month for your prescription. So one of the things that we'll do is we'll look at what the manufacturer's coupon programs will give you. And I know right now you happen to have Flex Access through Blue Cross. And what Flex Access is Blue Cross is looking at what the manufacturer's coupons are. But what you don't know about Flex Access is Blue Cross is taking 25% of the savings off that coupon. So put it in terms of an example. If the medication is $5,000 a month and the manufacturer will give up to $1,000 a month copayment assistance, Blue Cross will run that through. They'll give the employee $750 of copay assistance to eliminate copay, which helps reduce the cost of the plan, but they're taking $250 of that in the process. Most of our clients, most of my clients specifically, and I happen to have a Blue Cross Blue Shield board member that we do the consulting work for. Most of our clients, we don't go down the Flex Access road. Instead, what we'll do is we'll increase the specialty copay 20% up to $1,000 a month. And now we can capture that $4,000 from the manufacturer. Member doesn't pay any more than $5 a month because that's what the manufacturer will do. And the plan gets the $1,000 a month savings. So when I talk about managing risk, that's what you can expect from USI, literally. And you're not going to be overwhelmed with it. That's our job to manage that stuff.
Yeah.
But we're going to deliver it in such a way where you're going to know what that disruption will be like for your members before we implement any strategy. Does that help answer your question, Jennifer?
A little bit. The only time I've ever seen it that low though is either you are in income guidelines for it or you're not commercially insured.
Gotcha.
In payments. So I don't know if you see it in a different light.
In fact, there are some of our clients that make the decision to use what's called a patient assistance program. And a patient assistance program is where the manufacturers may give the medication to the member for free if the member meets certain income guidelines.
But a lot of us here probably won't.
What's that?
A lot of us here probably don't hit those income guidelines.
You know, you might be surprised. So we have one client, they happen to be a public entity. And I won't get into details, but it's based on household income. Household income family for the manufacturer said, if you make less than 150,000, we'll give you the medication for free.
If you're not commercially insured.
Correct. So what?
So it's like a double-edged sword.
It is. So
You're insured, but it's too much to pay out of pocket, but you can't get it for cheaper because you have insurance.
there are, without getting into details, there are ways to get that accomplished.
I'm gonna
That's fine.
cut us off there.
Yeah,
We'll
sure.
to the next one. Ron, do you have any questions?
No, I'm good.
Okay, perfect.
Bob, I
Thank you.
appreciate you coming in today. I think it was, I hope, enlightening.
Yeah.
We'll see where we can go from there.
Okay.
Please be in contact with HR director and our county administrator. See if we can't keep going forward and see what you can do for us.
Okay.
I'll reach out with some questions I have as well.
Okay. Sounds good. Thanks so much for your time.
Absolutely.
Appreciate it.
Thank you for your time, sir.
Appreciate that.
Good question.
Very good.
It was. I just feel like we
No, I don't wanna run it
can ask
around.
medical
Yeah.
questions till the sun goes down. Thank you, Bob.
Yeah, thank you very much.
I think that 160 number might have came from me because I think we're talking about overall people. We've got closer to 150 total employees. Like
Right, but not everybody's on our
insurance.
insurance.
Yeah.
Yeah, I was thinking.
Yeah, because I told him that, and then we saw it, I think it was last week, I saw the 106, I don't know where I saw it. I'm like, oh,
106 on the plan.
Must have heard that.
So that makes sense, because a lot of people aren't on our insurance, a lot of our employees.
yeah, sure,
So,
got a spouse, sure.
see, we were just gonna touch on some more budget review. We're really getting to a good spot where we've had a lot of, been doing this for months, weeks, and had all the departments in front of us. So I think we're getting to a place where as long as commission's comfortable, we may be able to just start actually presenting a budget as a whole to the community. I was gonna bring some updated CIP from last week. We went back through, and mostly that's gonna be on page 4 with the changes where we talked to the highway on the highway special equipment funds. And we were able to get a better idea on where Martin and Billy really think we're going to be in the next couple of years. So there was a lot of adjustments just to start with on page 4 for 2026. So you can see that a lot of those dollars shifted out right now. The items that we're still looking at for 2026 is one Chevy Silverado that is in the mix on there. We've got still one grader that we'll be considering. Not a grader, I mean, it's a semi truck actually that we'll be considering. And then one of the larger purchases that they do still believe needs to stay on there is the excavator that they do anticipate will have, that will need to be replaced in the year to come. So that's something that we're working on getting an estimate on right now. At $350,000 is just a number that's kind of been plugged in for now to make sure that we're covered. But Billy is actively seeking estimates from some actual vendors at this time. So we'll have some updated numbers there. Right now, we still have that funding in the special equipment. Right now, special machinery has a balance of about 1.4 million. So obviously, with purchases like that, that can trickle down pretty quickly, but we're going to make sure that we manage those funds moving forward. So I think we're in a pretty good spot to make sure that we're ready. We did have a good conversation with the enterprise fleet management. So just to give you guys a heads up, we're talking through and we're just going to present the ideas, make sure we're doing our due diligence. If there's an opportunity for an attack saving, we want to make sure that we get that in front of you. So that's not going to be settled in this budget, but we'll just continue those conversations and make sure that we present that to you as more information comes along. So for today, I'm just going to give you an updated number on just our notice of budget hearing so you can kind of get an idea of where we're at since we've made some adjustments. I think it was about a month ago that I provided you with this summary page based on some June numbers. So this will give you, after a few adjustments have been made, this will give you a better idea on where we stand today. If you are comfortable moving forward with the numbers that have been presented to you up to this point, we're right now settled in around a mill levy decrease close to 7%. It's about 6.75%. And that's would be a 3.634 reduction to the mill levy overall. Property taxes, that's also, we're looking at in property taxes right now, it's a little over 500,000, so about 516,000 is what we have at this point in the budget. So I'm very comfortable right now after working with the departments. They all presented what they felt like were some areas that they were able to reduce their budgets. We were able to utilize some of the carryover. We've had some savings even in 2025 that we're not anticipating that we will be spending. Some of that came from the personnel. We had the pay plan study last year. It kind of came in towards the end. So when we were plugging in these numbers for the budget, we had to put a larger number in, not knowing where that plan was going to settle. So once that did settle in, we actually came in lower. So I think, and there were some adjustments that came in later in the year that helped keep that lower as well. So another thing just to touch on the personnel side is in 2026, which is figured into this budget, there is an extra payroll, and that's just based on the way the calendar falls. So every 13 years, because of the way the calendar falls, you actually, a payroll slips into one more year. So we're actually, instead of 2026 or 26 payrolls that we typically have, we'll have a 27th payroll in 2026. So that is included in this budget as well. That can a lot of times cause some major challenges with a budget. Fortunately, we were able to get that handled in here as well. So there's a lot of successes, I think, in this budget. So I'm really happy overall with where we're at in this position. I really wanted to take today, and I didn't plan a lot of time because I think we've covered a lot of this already. But just the overall budget, there's a few things that we haven't touched on. So I just want to make sure that we had an opportunity in one of our public meetings to cover that. Sewer districts are things that are on there that not everyone's aware of. We do have a Talmadge Sewer District. We also have the Detroit Sewer District. We help manage those funds. They basically are facilitated through the county to help those operations, but those are covered by user fees that come in. So basically we assess a fee. The users of the Detroit Sewer, they might pay a check here through the administration office, and that check is to basically cover their the bond, the debt that they took out, that basically just we're the facilitators for. So it's not specifically really our department, but it is handled in our budget, so that's a part of it. But like I said, that's going to be covered through user fees and not through property taxes or anything of that nature. So that's the same thing with the Talmadge Sewer District. Probably the only difference is I believe those are all handled through special assessments, so that taxes that's kind of added to anyone who lives in that district's taxes. Where the Detroit Sewer, we actually do receive monthly payments for those users, and they come into administration, pay us directly, and then we apply that to the Detroit Sewer.
We still have bonds for Detroit Sewer District, or it's Sewer District 3. Talmadge is just the operation side of it. So there's a little bit of a difference there on what the dollars coming in are for.
And I believe that original bond, is that 40?
40 years.
40
yes.
years. So yeah, they just to make sure that their sewer fees were as, I think, as manageable as possible
Right.
for individuals that live in that sewer district. They kind of stretched out that bond a little longer than what we would typically do in like a county bond, but in that case, it made a lot of sense since it's paid down by only a handful of users. The City of Enterprise also is included in there. They utilize some of that Detroit sewer, and so they actually assess a fee to their customers in Enterprise, and I think it's 350 customers. We can get a check of about $3,500 that helps go towards that Detroit sewer bill as well. So outside of that, the only thing else I really wanted to cover, I wanted to get kind of the feeling of the room from the commission. If you have any questions, is there any additional detail, any departments, any sections, payroll, anything like that that you'd like us to go into more in depth before we continue to move forward with the budget as we have before you today? Because we still have a couple of weeks. Currently, I'm aiming, based on if it works for you, for August 21st would be the budget hearing. We would need to publish at least 10 days prior to the budget hearing. So that would mean we'd have until basically around the August 10th timeframe to make sure that we had everything settled before we actually publish the budget. We do have more time. I think it has to be done by October 1st. I need to look down and see what Thursdays fall in before that. But technically, if you needed more time, we wanted to get more detail in front of you, we could push out that budget hearing later. The August 21st is just the first available date if we feel like we're in a position where we're comfortable presenting the budget at that time. Did either commissioners have any questions or extra detail that you'd like to see in the next couple of weeks?
Anything wrong? I don't have anything. I don't think I do either. It sounded like we got even more detail this year. I'm thinking of Chanthy, for example. It sounded like he's never came in before, so I feel like these last, I don't know how long it's been now.
Going at it for a little while.
Yes.
Yeah, seems like it's been pretty much the job so far. So
Yeah.
I'm very comfortable with these numbers. I said it last week. I'm very grateful to the staff, to you guys, to helping us get here. I know I know I'm the one who pushed for this, probably the hardest. But I think the public is going to be, I hope they're going to be impressed. I hope they're going to be, it shows that we are conscientious and that we're trying to do everything we can in these inflationary times to try to curb our spending and try to help that tax bill. We are one entity. I'm going to say it loud and proud. We are one entity that taxes. And that's all I'm going to say on that. But I'm very comfortable with it. Thank you. You'd be all right with that, Ron? I say we go ahead and plan for the budget hearing to be on August 21st and the announcement to be on the 11th.
Yeah, and
We can publish it anytime now.
Yeah, anytime, this is at least 10 days. You want ahead, because if there's any publication, they'll have time to fix that.
Gotcha.
And we've had that happen in the past. So.
yeah, so
Whenever you guys are
the
ready.
earlier the better. So yeah, we'll even
Get it
once
now.
and I don't know what you guys think since Lynn's out today, if we want to wait just to touch base with him next week and make sure, but if
We
that's.
definitely can. I think let's preliminary plan and then let's get his bite in.
We'd still have plenty of time after next Thursday, because as long as all three of you are on board with that, then we could pretty well publish it anytime after next Thursday, then if we heard from Lynn also.
That's probably the right thing to do. So let's wait till next week to finalize it, but
Sounds good.
thanks.
Yep. That was quick and easy.
That was quick. Well, we have about 34 minutes. I think this is the first time we've ever ended study early. So why don't we take a recess until the regular meeting at 11 a.m.
That's good.
Thank you.
Got to go to upstairs for cover case with Judge Googler.
Okay.
At 11 o'clock, so I won't be back.
You want to sign your stuff while you're here then?
Yeah, sure. Be glad to.
You won't have a report today.
Can you?
Probably not. Oh, Bruce. I'm sorry.
Nothing's changed with the tax sale or anything like that. That's probably the biggest thing that people are.
That's what I'm thinking
You
about.
already got that. You already have that date, so you know where we are with that.
I appreciate it, Doug.
Sure. Appreciate all the time you're putting in on this and the work that goes with it.
Likewise.
We got a good team.
I think we do too. We got a great team.
And that gentleman was a very good. A lot of good ideas. As I was sitting there listening to that, I said, wow.
I'm glad he came in.
Yeah.
Dark perspective, it seems like what we've been hearing.
Mhm.
That's what we wanted though, right? We needed more perspective.
Right.
Yep. Thanks, Doug.
Thank you. Did a good job.
Yeah, it's,
Goodness, close back. Yeah. What do you think about the USI guy? Interesting.
Yeah, and I come from a different perspective. I don't like any of this crap. I feel that hospitals are out to get you. Insurance companies want to screw you. And I've over 60 some years paying in insurance companies and have learned to walk in there with cash, tell them, shut up, what's it going to be, and pay it. Because otherwise, between all the hands it changes, it costs money.
Yeah.
And unless you're an expert on chemicals, medicines, policies, you're screwed. You just got to be very careful to who you dance with.
Yeah.
So that's where I come from. I don't get into them. Now, here's where another perspective though, looking at the county point of it. We are paying, and we're concerned about the dollars because these are tax dollars, the taxpayers' money.
Mhm.
But the employees have got to understand they've got to take a risk too. That is, if they're doing unhealthy things for their health and we're paying insurance for them, that's not right. If you're a chain smoker, you're an alcoholic, you blah, 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 you could be costing the county a lot of money. So they need to take a portion of that too, kind of like sweat equity, and then put into this insurance stuff also to save everybody money because it costs a lot of money otherwise. I mean, if somebody's buying your insurance for you, pay your insurance, you need to take the forthcoming part of trying to be healthy.
That makes sense.
You know what I'm saying? I've worked for some different people that if you smoked, they wouldn't insure you. I know it sounds rude because that's a risk. That's a risk that, you know, and that was just a small example. So employees got to understand, and that's good. Now, I do believe in keeping money in our community, in our state, things like that. But I understand competition too. But it's, you know, it's like a boardwalk. You go out there, you don't know what you're going to step into.
Mhm.
You know, it's just. So what's our love letter today?
Lincoln's yellow there.
Oh, okay. Oh, thank you. That's good, 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 good. Yeah. So.
Get smaller up there.
Yeah. Okay. How you doing today?
Okay, how about you?
Good. We got some moisture coming down. That's kind of helping that row crop a little bit and settling the dust, isn't it?
It's wonderful.
Yeah.
Hope it's enough to hold us over the next 10 days.
Oh, yeah, yeah. Did harvest go good for you folks?
It was pretty good.
Very good, very good. I hadn't heard any complaining really, so I thought, well, folks must have gotten along pretty well out there then.
Well, I hope Mr. Peterson doesn't have water in his basement again.
Yeah, and I told him, I said, you know, we, a lot of times when we leave like that or whatever, we normally shut our main line off just for protection. We just turn the valve off. So, because it seems like there's always something that happens. It's just, it's going to go wrong. It usually does. So, yeah.
Maybe I can ask you, I sent Kenny a text message. Have you guys discussed cemetery budgets or how is that?
I think that's township stuff.
It's all town?
I think it's township stuff.
Okay. Do you-
Because we don't ever, I don't think I've ever discussed anything about cemetery.
Well, I've never heard anything and nothing came up and I wondered,
Yeah.
how do the townships get their monies? I mean, does it vary? I don't know who to talk to.
Janelle will be a good one for the township stuff. Talk to Janelle, because they send them the money for the townships.
I wonder how they arrive at that budget.
Well, you might talk to her and get the better answer. But yeah, I know a lot of them are hurting.
Well,
You know,
ours has gobs of money and
you think,
thousands of dollars. And I wondered how,
yeah. Well,
I
some,
don't know who's hurting and who isn't. There's a lot of cemeteries in Dickinson County.
yes, there is. Yeah. Yeah, that's for sure. And it takes money to take care of those cemeteries too. That's just,
Well, if they're being taken care of, yeah.
yeah, to find help to keep them up is sometimes, it's like anything, you can't find help anymore. It's just,
It's difficult.
you get out here in the agriculture world and it's just, I don't know, it's just all different.
We'll see if AI can help that.
Yeah. I hear you. You know, the world's changing fast. It's not like it was back 50 years ago, I'll tell you.
Oh, no.
With simple times and all that kind of thing. That's just, it seems like most of our problems are now technical, complicated problems you can't do anything about. You got to have technical people to come in. Where years ago, if you had a hammer and a little bit of wit, you could make anything run or go and repair.
Yeah,
Now it's completely
everything requires
technical stuff.
something, yeah,
Hmm.
computer related.
Hmm. Yeah.
But the one thing that hasn't changed in that same prices, they're not different.
You know, I managed a co-op for 15 years. I never seen the likes of it in my life. You could have prices change so many times in a day. One producer could come in and get one amount of money, and 20 minutes later, another producer come in and the market has already changed. That to me was crazy. And it seemed like everything we did out here, we paid both ends of it. If we wanted fertilizer, we had to pay to get it in. But if we want to sell our wheat, we had to pay to get it there. We were never on the right end of the stick. We were like the small fish in the sea, to be honest with you. And it's just not a very leveraged deal. If it wasn't for cattle once in a while hanging in there, I don't know how you could do it, you know.
Well, you gotta have your wife working off the farm.
Well, and sometimes two jobs. Each of you have two jobs.
Mhm.
You know, I can remember when wheat was less than $2 a bushel,
Mhm.
and everybody had CCC, Commodity Credit Corporation loans on their wheat,
Mhm.
just to help. Hopefully, it would get better. And
Mhm.
oh, criminy sakes! And we know, but you know, back then you could buy a pickup truck for $3,500, a new one.
There is.
Remember those days?
The issue, I mean,
And you,
B7, we got to $5.08.
right? But still
We
not.
can't even get $5 now.
No, but fertilizer and everything has gone up so high.
Oh, tremendous.
You know, and
I
stuff.
don't even know the percentage.
You know, it's, and I got in trouble, I'll tell you, to be honest with you, because being responsible for the co-op, you had to make money. I mean, the bank would shoot you. And so each year we made a little money, and some of the producers got mad because they weren't making any money. But they had more at risk than we did. They have all that equipment, the land stuff and everything. They had more at risk. And it was very difficult to recoup or show a profit at the end of the year. It's terrible. And people don't understand that. And wait till we start having to buy wheat from the Soviet Union or something. We're going to be in darn trouble, I'll tell you. Our food is safe right now, but when it leaves our hands, that's my opinion now, it's not going to be the same as it used to be.
No, I can see that.
So, yeah, what you're saying.
I don't know where it's all gonna end up.
Well, we just pray that the guy upstairs is knowing that we trying the best we can do. But I've seen a lot of fine people. You know, I can remember in the early 70s when land devalued,
Mhm.
and folks were solvent, and almost overnight banks were calling in loans because all of a sudden the equity in their land wasn't enough to cover their loan.
Yeah,
Overnight, they did nothing wrong, and all of a sudden they were insolvent financially, basically on paper. So it was terrible, terrible, terrible.
Well, in the 80s,
Mhm.
mercy, those were dreadful.
Mhm.
Okay.
Yeah,
Well, that was really interesting, what your first speaker, that Bob Spence.
yeah,
I have not trusted pharmaceuticals for a long time.
no, not personally, I wouldn't. I'd be careful of all.
Didn't care for what?
I'd be very careful of all of it.
Yeah.
All way to walk into a doctor's office or hospital and see what happens. And my goodness.
Oh, it's been, yeah, mixed up and turned kids as bad as.
And if you can't read and understand some of that stuff, and most of us can't because of the words they use, like medically not necessary and stuff like that. My wife had cancer just recently, and that could just get you, man. I'll tell you,
Yeah,
all that stuff. So,
well, and just the biosimilar versus generic.
mhm.
And at one point, he called it biosimilar, and then another point, he called it bioidentical. That's on purpose.
You bet it is. Yeah.
But it's good to have somebody who can interpret all that stuff.
Well, it's good to have a broker that can look around and see what the weaknesses and strengths of some of these companies are, because we're not smart enough we need to have that outside expertise, a neutral party looking in on us to make sure we're doing right by the people that live out here.
Oh, yeah.
I mean, it's just, you can't be over knowledged here. It's just, you have to ask for experts. That's just
Right.
all it is to it.
And, yeah.
You know,
Even the experts need to be watched.
you have to be careful. You darn right you do.
Yeah. I'm gonna check with Janelle on cemetery.
Yeah.
This is a busy place today.
Yeah. Probably a few people probably thought they could get away with the weather like that, not lose out on so much work.
Well, I think the court is in session, so there's lots of extra people.
Yeah. And this crime has gotten, I don't know, it's almost out of control. So much crime today.
Yeah. And I don't know the half count.
Yeah. I deal with the youth, the juvenile detention folks, and
Yeah.
the crimes that's going on today is a lot worse than they ever were before.
Oh, yeah.
It's not just a petty theft or something.
No. And some of these gangs are using underage kids to do it, my understanding.
Our little community, Woodbine, they got a little gang that kind of comes and visits there. And they carry these machine, they shoot just a few feet outside city limits all night long. They're shooting and stuff. Yeah, oh yeah, no. And if you're one to say much, you can get in a lot of trouble by them. You got to be so careful. You can't confront them. Yeah.
In Woodlawn,
Mhm.
where did they come from?
Junction City, I believe, some of these gangs. It's quiet out there. They might have a friend that lives out there or whatever. I don't know, but
Do they just want to raise Cain, or do they
They wanna
want to steal something?
the theft part is not so much right now. It's mainly shooting and stuff. But that's scary.
Oh, yeah.
4th of July and you hear weapons going off and everything else. And I'm talking, they have like these automatic weapons and all these, stuff that it's not like a 22 or rifle that we should go out and dove hunt with or something. It's these assault weapons and things.
Mhm.
Yeah, it's, and a lot of the folks are afraid to say anything because they will retaliate against you.
Hmm.
So, yeah, no, it's not good. When you have residents that want to put cameras in their home, they got cameras already outside their house, that's telling you something's not right.
Hmm. I just asked Ron, I
Yeah.
sent you a text, he said, check with Janelle, I can't, she's,
I know that we don't
Yeah,
manage them, but they're managed by their own, and it's kind of like a township,
yeah,
Yeah.
yeah.
but they're their own district.
Yeah, I'll have to check into township budgets because I don't,
Yeah, I think you're right. They do run through the township, don't
Yeah.
they? Yeah,
yeah, that's what he said.
Yep.
Yeah.
There's a lot of them.
oh, there is so many.
Oh, my stars.
There's a lot of them. So,
Yeah. Well, and like I said, it's hard to find workers or lawnmowers or, you know.
it is.
maintenance, and kids can get in and do so much.
Well, but now with labor laws too, you can't hire a
That is-
15-year-old kid anymore.
that is so foolish.
You know what I mean? I mean, I know when I grew up, it wouldn't, I think my senior year it changed, but now, of course, I work for the owner and you can do that at a younger age, but, or my dad, you know, it was family. But God,
Yeah.
10, 11, 12, I don't know. I don't even know.
Well, kids need that work. That's.
Need money.
that's
I
ideal.
pushed brooms in the warehouse. He gave me like $5-10 a day. I rode my bike to town. It was a 3-mile ride. And I went to the pool the rest of the afternoon with the money I made that day.
Yeah.
There you go.
That was what I did.
Yeah.
It'll give you ownership of the business a little bit as far as caring for something,
Yeah.
learning to work and all that stuff. I did that at our little town. I hired the kids there was quite a few kids at one time, and to mow. All they said, Ron, they're going to sue you. You're going to sue. I said, well, the parents are going to supervise them. We'll lot certain lots that they mow, and that then in the month they get a paycheck. It wouldn't be inspected, but their parents would be the supervisors. And we could have got in trouble, to be honest with you, but we didn't. And the kids were just tickled to death. They had a job, they had something to do, they had money. You know, kids love to spend and go buy things, and everything was mowed, you know. They like to, yeah.
And they need a reward for work.
Mhm.
Anything like my youngest boy, I mean, whenever which, you know, every day you're tooling on your house and he wants to know what I'm doing,
Yeah,
Yeah. Exactly.
which, you know, I like.
I think getting them out of the house, you know, that there for a while, they were so tied up to those little computers and stuff.
And we,
that,
yeah,
You know,
we do a healthy, we try to, you know, I don't shy away from them.
No,
They're going to use iPads.
yeah, no,
But, yeah, you got to limit the time. They need to be outside.
Mhm.
That's really the message. Outside and get a scrape or a cut or two
Sure.
and learn a little bit.
Yeah.
It's like I read an article when grandmother went to pick her grandchildren up and they got in the back seat of the car in the house. They went to her house, and on the way there, the kids never said a word to her. She said, if you're not going to talk to me, I'm going to turn around and go back because I'm bringing you because I want to visit with you. I want you around me. So he took them back to home. And until one time like that, they decided it was good to talk to grandma. Yeah.
I know grandparents who have a basket by the front door, and when the grandkids come,
There you go.
turn the phones off in the basket. So
Absolutely.
when they leave, they can have
Unfortunately, their grandparents are too
too generous.
a little easy on them.
Yeah.
Well, it's hard to be hard on your grandkids.
I know, you know, I asked my mom and dad, I said, man, your heck of a lot nicer than my kids as you were us growing up. Well, you know, just like, you
The
know,
responsibility level is completely.
I'm like, I think you're focused more on the fun. And he goes, well, that's what your job is. Fair enough.
But you gotta stay with people. That's a great one.
But my kids got a really good relationship with their grandparents, and that's really important.
Yeah.
It's something I feel like, you know, everyone moves away and we're blessed. Both our parents, we all live here. So they see both sets. And when I grew up, my family was from Chicago too. So, you know, I didn't see them very often. And to be honest, it's a free babysitter. So
Yeah.
My kids had that, but my grandkids don't.
Really what I'm getting at is I feel like it's pretty important societally that they hear from
Every man.
you know, not just their parents or teachers that, are younger. They're hearing from the other generation. They're hearing from all the generations.
Yeah.
They appreciate it more because I think my dad was in World War II and his brother. And I wouldn't appreciate World War II if I hadn't had those two men in my life.
Mhm.
Because just to learn about it at school or whatever, and it trickled down to my kids.
That's weird you say that. My grandpa was a Vietnam War vet,
Okay.
and, a lot of, that was a pretty bad, anyway, same
It
idea.
was a bad deal. It was a very bad. It's still a bad deal.
Well, and he's got, Parkinson's now because of the Agent Orange. And, but it's history. It's war is hell.
Yes.
They don't want to do it.
Well, where you been, Marla?
I listened online a couple times. One time, the sound was terrible.
I think we got it fixed now.
And I
I know.
wanted to just call Justin Parks and say, go sit in that room and don't leave. Because, but I restrained.
Yeah, we got it fixed. We were having one computer that was running everything, and it basically broke. I guess I don't know. It's like an engine that revved too high, I guess is the right way to look at it.
Yes.
I think we got it fixed now, though.
So by putting the podium over here, you have better sound.
No, I don't know why we really did it. Mainly the camera. Can't really see you when you're over here, so you can't really see the speaker. Was kind of what we talked about this morning. There was a while there that the podium was more back there, and you didn't see who was talking.
Right.
And I think some people, well, at least me, when I'm watching a video, if I can't see who's talking, I'm like, what am I? Why am I watching this?
A cherry Pepsi.
Well,
That's what
I'll have to get a hold of my house now and tell them that.
Who does it?
The house.
Not getting any less. I'm like,
Oh, hey, shit. You might explain it, but the cemeteries run through the townships. Right?
Nope.
No.
Some cemeteries are part of the township, but there are most of them that are by themselves.
None of them are.
None of them
through
are?
the townships.
Okay.
Only
They
one
used
is
to be.
through the city, or
Marla was asking.
one of them has it.
Marla, all the cemeteries are standalone taxing entities, if you will. They don't run through a township,
Except for one.
except for one, Solomon.
okay. So how do those budgets how do you know what cemetery is gonna get how much money and how? Does that change or,
This lady can answer that.
We do them all in our office, yeah.
okay,
Mhm.
okay,
Only one exceeded, that was Evelyn.
exceeded their budget?
The R&R, not the budget, just the R&R.
So the R&R is the revenue neutral rate.
Yeah.
Right.
I'm trying to calculate.
Yep.
Remember that. Okay, well, our little township, Bell Springs, has a whole bunch of money. And we have a wonderful family that mows. And we're doing some fence work and taking out some trees, et cetera, et cetera. I just wondered how they got so much money.
Some of it,
It could be donations.
that's what I was gonna
A
say.
lot of them are very minimal. The cemeteries are just to mow and pay their publication but then they have some put away from donations and
Right.
I'll bet
And
that is
stuff,
the way.
like private. Yeah.
But they're taxed. There's a tax on our deal for cemeteries.
Yeah,
Yes.
they have a
Yes.
levy
They
too.
submit, just like a township, they submit their own budget to
Okay.
us.
Yeah.
Yeah.
If they have a lot of money, they probably got a donation from something.
Mhm.
I was gonna say, the one that I think, I can't remember which one I looked at, but we were very tight. They-
That's what I,
Within thousands, I feel like.
yeah.
Then there is, people, are they are elected, correct? You're not elected?
No,
Cemeteries.
cemeteries are not elected. They just, they're volunteer, but they have a,
Hmm.
right, townships are, yeah. They just have a board that manages their budgets and
They usually live around that area. Sure. If you ever have any questions, you can come over and talk to me. I don't mind.
Well,
I'm just down the hall.
yeah. I didn't know about our Dickinson County. until
glad you're
the
here.
last couple of years. Learned a lot from the fellow that talked.
Wasn't that fascinating? Mhm.
He has an excellent background for what he's doing.
Right.
He's a pretty smart guy.
So,
Very good.
let me make it bigger. You're so welcome.
Is Amber the one that's selling, that goes, is it different?
Different, yeah. Yeah. These things. Yeah, just right. Yeah, yeah. This Amber is the deputy director in Slim County.
Okay. Yes. He told us that.
Yeah, I think it's a real coup.
Good, I hope she works out well.
I have no doubt that she will. You want, since it was a letter.
Do they want to go to that?
Well,
Is it too
hang
far
on
to
to
find out?
it and we'll show it to Lynn. I'm sure he got one at home, but. Or not business, but.
Marcus, what year in school is your?
It's off now.
She's,
I'm sure she did. That's not one picture.
Next year I'll have 2 high schoolers.
Well, that might be easy sometimes. When you're going between 2 different schools or junior high and high school, but switches can be,
can't see it.
daunting.
It's like, it's raining, there's no place.
That's why it's like this. And the bad thing is, I had a hair appointment set for Monday, but I had to cancel it because of interviews. So it's not till next week. And I liked it. Yeah. Yeah. Yes.
Try to.
I don't know. I don't like to do weekends. So I have to rush and get back. I do some shopping because mine's in St. Louis.
Oh, okay. Good. I was still.
Birthday's here.
Must be, probation.
His anniversary, so that.
I did see that, yeah. Yes. Imagine it's gonna be a big one.
I'd love to go to that, but we both go, I don't know. Can we go to events without there in a meeting?
Yeah. We would, you can.
But we gotta
You
publish.
would post it on the website that you'd be in attendance.
Yeah.
Okay.
Never been
Mhm.
and keep getting questions, so maybe I ought to go learn.
So do you want to bring it up next week at the meeting and that way he's in there too?
Yeah.
We'll just put it in the packet for next week.
You put it in your folder to remind yourself.
Yeah, you're right. Do that.
Fall apart, but.
I would, you and my wife, I told her that. That name. Okay. I don't have a.
I can work in its mouth. It's probably in the drawer, middle drawer maybe for board.
I'll bring this meeting to order. If we'd all stand for the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Yeah, one of them.
Sorry, we don't use the crayons anyway. All right. As you guys will notice, we are missing one commissioner. Lynn Peterson is gone today on vacation. Moving on from there, we have the approval of the agenda. We have a pretty light agenda today. You'll find the minutes in your packet. We're also going to designate Tim Hamilton, Planning and Zoning Director, to represent the Board of County Commissioners during the notice to take deposition regarding the Johnson versus BOCC Dickinson County. Do I have a motion to approve?
I'll make a motion to approve the agenda.
I'll second that motion. All in favor, say aye.
Aye.
Aye. Motion carries. Moving on to consent agenda. As I said, minutes are provided in your July 10 meeting. Payroll this week of $428,696.62. Credit cards of $39,491.53. Utilities of $10,349.65. SD security of $4,104. An abated tax of $368.76. Do I hear a motion to approve the consent agenda?
I'll make a motion to approve the consent agenda.
I'll second that. All those in favor say aye.
Aye.
Aye. Motion carries. Commissioner comments, committee reports. I'll start this week off. We had the re-election of the 70th District Representative this week, where Greg Wilson was chosen by the delegates of the 70th District. I want to say congratulations to Greg Wilson. I thought I had more. I don't. That's all I got. Ron?
Yes, I did spend a little bit of time Friday at the Harrington Fair, judging the floats and things that came by. And I want to thank the folks for the county involved with what they're doing. And we did get a lot of compliments of the support that the county does for those areas. And to continuously need support, it takes a whole handful of people, obviously, to keep the fair going. And so they're very appreciative of seeing us and being involved with what they're doing. And I have to compliment all the float folks, and they did a wonderful job. Wonderful floats, good parade, and pretty neat fair. So thank Harrington.
Thank you, Ron.
Yeah.
Moving on, we have no presentations of petitions. We'll move on to public comments. If we'd have County Administrator Janelle Dockendorf read the rules first.
Per the Open Meetings Act, KSA 75-4317 and 75-4318A, as the elected board, the county commission is not allowed to meet or make any decisions without posting the meeting. They are only allowed to act on items on the agenda which they set. During the regular meeting, the county commission may allow for public comments on items not listed on the approved agenda. It is at the discretion of the county commission if they allow comments on agenda items. If you wish to provide comments, please come forward to the podium and state your name and address. If you are online, raise your hand and we will unmute you. Please state your name and address. Each person may speak for 3 minutes. The allotted time will start after the speaker has given his or her name and address. Public comments shall be addressed to the county commission only and not to the speaker or the audience. Only the county commission will be permitted to ask the speaker questions. The public comment period is not a back and forth discussion with the county commission. You should make your views and input known to them, but it is not a time to ask them questions. You should not expect them to respond to your comments. Comments may express support or agreement with the previous speakers, but in the interest of time, please do not repeat the same information. You may state something to the effect of your name and address and you agree with the previous speaker. It is important to maintain a respectful, non-threatening atmosphere for anyone who would like to speak. Please do not engage in such actions as cheering, booing, clapping, insults, threats, etc.
Thank you, Janelle. Do we have any public comments at this time?
Don't see hands raised either.
Just give it 30 seconds here.
Sounds good.
So there's no public comments today. We'll move on to report from county officers. We'll start with County Administrator Janelle Dockendorf.
Commissioners, the Public Works Department has completed the overlay on Old 40 from Solomon to Abilene, and I think it looks really good.
Good too.
Just as a reminder, they will go back and shoulder and paint stripe it, but they're moving on to the other summer projects while the time is appropriate. So That will come later. So I know Martin has had people asking about that. It will happen, just not tomorrow. And actually, they're starting chip seal on Solomon Road at K18 starting Monday. So just FYI.
Okay.
The appraisers department has completed 50% of their annual maintenance, which is required by statute. The emergency manager is working with departments and the Central Kansas Free Fair on the emergency operations plan for the upcoming fair. The Planning and Zoning Board has a meeting tonight in the basement meeting room starting at 7. I'm very happy to say that we have filled the open emergency communications director position. Amber Piper is starting on tentatively August the 4th. She is the deputy director from City of Salina, so we're excited to have Amber on board. It'll be great. County offices will be closing at 3 p.m. on July 29th for the Central Kansas Free Fair Parade. And thank you to the commissions for allowing that. So, and that's all I have.
Thank you. Any questions, Ron?
No questions.
County Councilor Doug Thompson is not in session today. He's up in court currently, so we will move on. We got no notices or communications, resolutions, but we do have some other business. This would be a vote to designate Tim Hamilton, Planning and Zoning Director, to represent the Board of County Commissioners during the notice, take deposition regarding the Johnson versus BOCC Dickinson County. Do we have any discussion on that? Pretty straightforward.
Yeah.
Yep. Okay.
I'll make a motion to accept Tim Hamilton as the representative for the Dickinson County Commissioners.
So moved, and I'll second that motion. Any more discussion? All those in favor say aye. Aye. Motion carries. 7 minutes. It's got to be close to a record.
Thank you, it is.
Okay, and I think I took it about as slow as I could. So that is our business today, folks. So with that being said, I'd entertain a motion to adjourn.
I'll make a motion to adjourn.
I'll second that. All those in favor say aye.
Aye.
Aye. We are adjourned. We're going to briefly return back to work session. Commissioner Roller wanted to ask Sheriff Davis some questions.
Do you want me to go ahead and call Angela now, or you want to go ahead and?
I want her on the phone with us. Open discussion on the phone. Okay. This is the detention center in Junction City.
Angela?
Yes.
Yeah.
Has questions for us too. So.
Okay.
This is simple.
Should be.
Well, I believe just.
Hello?
Angela?
Yeah.
Hey, so this is Janelle, and I've got Ron.
Hi.
Ron and Kenny in here, as well as the commissioners.
Uh-huh.
And then Sheriff Davis, our county clerk.
Yeah.
The assistant county administrator, and then
Uh-huh.
one of our citizens is in the meeting.
Okay.
We're in a study session right now, okay?
Okay.
So I understand you have some questions.
Well, and I had sent that before. I talked to Sheriff Davis since regarding the information. I sent that beforehand. So just so I understand, you guys are wanting information, the number of kids and the number of days.
Yes, correct. Okay. Okay.
I'm just verifying that this is all correct. Because initially, the first phone call I got was not from Sheriff Davis, and I was a little confused. And so then I told that person to have Sheriff Davis contact me
Okay.
so I can get a full understanding of what everyone is needing.
So he had one of his jail staff, his lieutenant, call and request that. We're just trying to, I think, get a good idea of the number of juveniles that we have in the detention center and for the length of time. Give us some history of how many Dickinson County juveniles are there.
Okay, yeah, and I was just a bit confused because the information that I was told from the lieutenant that called, it was that people were upset versus not what Sheriff Davis said, just trying to put things together. So that's why I was just a little confused.
Yeah, no, nobody's upset with anybody. I was just trying to.
Yeah, I'm just telling you what I was told. And then when you called and I talked to Sheriff Davis, it made complete sense.
And what I want to do is I want to change our procedures on our booking procedures too. We book a juvenile in, we can only keep them for 6 hours. So what our jail's been doing is when they get transferred to juvenile detention, they put them as released in our system to the juvenile center. Well, they're not released from custody, But they do that because of the 6-hour rule. We can't hold a juvenile for more than 6 hours. So what I want to do is I want to change the procedure where we book them in, we keep them in custody, and then we put as the location where they're being housed as a juvenile detention center, and then work out.
So, and I got to thinking about this too. Why are they not listed with juvenile intake? Because once they're arrested, they should go directly to juvenile intake. And then they would be automatically be released to juvenile intake.
Yes, they do, but we want to keep track of the duration of their stay at the facility because they're technically in our custody at that point. They're just housed at JDC.
Right.
So we want to track
Right.
their custody with our agency.
Okay.
And what we're doing now is we're releasing them to JDC, which takes them out of our system as far as in being in custody.
Okay. Okay. I'm calculating here because, and I'm working on that. I will tell you, it's gonna take me a little while because that's a lot of numbers all at one time. But I have started working on it.
So Angela, let me ask you this, on the budget report that is submitted, you take that average?
This is a
number-
rolling out, 5-year rolling
Right,
average,
right.
yes.
Would
And
some
the
of
year
those-
amount is on the budget, how many days it should be.
So I'm thinking that at least is a place to start.
Yeah, I'm just trying to get the number of kids for you guys.
Right. Yeah, so we need the number of kids.
Yeah, that's all. I mean, if that's on your budget report, then that's got.
I don't know if that's got the number of kids or just the number of days.
Number of days
It's
is,
the number of, it only has the number of days. It doesn't have the number of kids. And so I can get you the number of kids, but the number of days is already on
I
there.
think we can find the number of kids elsewhere. It's the number of days that we're not getting.
Okay.
Now, you also have to keep in mind that in there, that also includes electronic monitoring that we pay for per your county.
Okay.
So,
So that makes,
I'm concerned.
you know what I mean?
mm-hmm.
Because EMD is also, per county is included on there. EMD is just a little cheaper.
Okay. Okay.
So, yeah.
And Angela, this,
Actual, and so that would include the number of days, it'd be included in the number of days as well. So, but that is Dickinson County. Let me find my paper, hold on. So like, on the one the 2025, the one I gave you guys, the 2021 will be 50, 2022 will be 193, 23 is 1124, and then 24 is 682.
Can you shoot that to me and I'll make sure that the sheriff gets that?
Yeah, I can, yeah, give me just a little bit and I can, yeah.
Okay.
Well, and I can email it to him too. He gave me his email address.
Okay, perfect.
Yeah.
okay, Angela, this is Ron speaking.
Hi, Ron.
Hi, how are you doing? Real quickly, good. Real quickly, contracts. The folks here have reviewing the contracts and they're quite old. Can you tell me how old our contract is with Dickinson County?
The agreement when the juvenile detention was set up was kind of what we're looking at, Angela.
Well, it should be revisited in an interlocal agreement. Let me get Sean, because Sean handles that. Hold on a sec. Sean, can you come here?
Surely we've got something more current than that if we want a 5-year.
They're asking of Dickinson County of the commissioners, I'm putting on speakerphone. Everyone is on here. They're asking about the contracts now with Dickinson County. How old is it? And I know, how often do we revisit the interlocal agreement?
We don't ever revisit the interlocal agreement. It's just ongoing. You should have a copy of it.
It's from 98, Sean.
What's that?
1998.
Yeah, 1998.
No, actually, it's from 1994 for Dickinson County.
Okay.
Okay, the issue I've got with that contract is the juvenile statutes that are listed in that contract aren't even on the books anymore. They're not even valid because all the juvenile statutes were updated several years ago. So,
Yeah, they were.
so that contract doesn't have the proper statutes or anything like that in it. They're all outdated.
You'd have to show me which statutes are outdated. It could be. I don't know. You have to show me which one. I have to research it. Or I can look it over and see if I can research it and see if I can find
Okay.
if any of them are outdated. But the juvenile offender statutes are what were changed as far as I know.
I'm not aware of those other stuff. And it's possible they did. I just wasn't checking.
Yeah, and they're not current. I looked them up and they're not even on the books anymore.
Sorry about that, Kenny.
Oh, no kidding. Okay, yeah, I have not looked at it. Yeah, you bet.
That's the thing that prompted me as far as we needed to update the contract.
Mhm.
Let's see, that's fine. Yeah, we can do that. I can have an attorney draw one up and redo it and board can approve it, but it's got to go to the state of Kansas for final approval. Although I'm not sure if that's the case anymore because now Gary County is actually the owner of this building.
Mhm. Well, I think that's something that would probably make sense to all of the counties involved in this.
Right. Okay, I can definitely bring it up at the next board meeting and we can decide how we want to handle it. You bet.
Okay.
And then Sean, I had one other question. What happened with an inmate or whatever that was transported there and the folks here had to move them themselves? What, tell me that, what's going on there? Jerry?
I think I can answer that.
When they get transported to another.
Yeah, I think what you're saying is that they called us and we were full, so we had them transport to another vehicle. They did not come here first. They simply transported to another county or another detention center.
Do you guys understand?
So, did you take them over to Junction?
No.
Okay.
We called, they were full. And from my review of what we've got is, and from talking to Angela last week or earlier this week, I've got that all lined out.
Okay.
They have custody of the juvenile, basically.
Okay.
But they don't have beds for the juvenile.
Right.
So they make arrangements for the placement of the juvenile, and then it's up to the agency to transport the juvenile to that facility.
Yes.
Okay.
Yes, and then our facility pays for their stay at wherever entity. That is correct.
Okay.
Yeah, we talked about this last week. Yeah, we got that all fixed
Okay.
and understood. Yeah.
Because my recollection was that if we bring somebody over there, then you guys, if you don't have a bed, then you transport.
No,
Okay.
and we stop it, like, how it's been is they typically will contact us, let us know, hey, we have a juvenile intake, let us know, hey, we got so-and-so coming in, and then we let them know, okay, well, we don't, let's say in this case, we didn't have a bed available because we got an influx of kids. I said, give me a second, I'll find you a space. We call, we find a location, we deal with all of that, you guys just drive. So the kid never comes over here.
Okay.
Okay. All right.
And we were all under the impression before that we got into the facility and the facility transported.
Right.
We cleared that up last week.
Well, see,
Okay.
yeah, no, it's whoever, because see, with the state of Kansas, the juvenile is only in our care, they're not in our custody. Technically, they're in your custody, and we legally cannot transport them
Okay.
unless it is an emergency situation like life or death, something of that nature.
Okay. That makes sense then.
Okay.
Yeah, they're only in our care, not our custody. They're in the custody of Dickinson County.
Okay.
And Angela clears my mind. I mean,
Okay.
she kind of talks my level.
Well, I want everybody else.
Hey, I haven't met you face to face. I'm gonna have to drive over there and meet you one day.
We got to do that.
Absolutely. Thank you very much.
Yes,
Is
Angela.
that everything, Ron?
Yeah.
That's everything. Yeah.
And Angela, is that everything on your side?
Yeah, I think so. I just was very confused because, when the lieutenant called and said people are mad, I'm like, well, what? And then I'm like, well, you tell Sheriff to call me. And then he called and it was a completely different thing. And I'm like, oh, well, then it's okay.
I tell her at one point we were thinking about building our own facility.
Yeah.
Okay.
I mean, you go ahead. I will give you the names and numbers. And remember, you cannot lock the doors.
Okay.
You cannot lock the doors, okay?
Good enough.
Thank
And if
you.
there's anything else you guys need, just let me know.
Will do. Thank
Thank
you.
you, Angela.
Bye-bye.
Bye. Okay.
It's better to get all parties.
I think Connie and I had talked about the problems with the transport. And I
Gotcha.
think she thought,
Yeah, that makes
and
sense.
that cleared it.
I can interpret it wrong and get it really messed. That's why I like everybody in here.
Well, and I'm glad you did because my understanding was, yes.
So
So the study session has been concluded, so I'm going to shut everything down.
thank you.
Time.